Welcome back to the Mountain Man Medical YouTube channel. My name is Doc. Thanks for joining me. Today I wanted to talk a little bit about some of the steps that I think you should take when dealing with an emergency trauma patient. These steps aren't going to work for every situation that you encounter. Of course, emergencies are very dynamic. There's a lot of changing and moving parts. So this isn't going to work completely across the board, of course, but this will be a good basis for you to get an understanding of what to prioritize first. So stick in there with me and we'll go over a little bit about what I think the 7 steps to saving someone's life is. All right, so the first step that I think is the most important is to call 911. This is an emergency. You need to get that patient to the hospital. So you need to call 911 and get an ambulance on scene as soon as possible. So this is important because there's a short window of time that casualty will be stable, and they need to remain stable long enough to be able to get to a hospital so that a doctor and all the nurses can start working on them and actually save their life. So step number 1, call 911 as soon as possible, get them on scene, get your casualty to the hospital. Step 2 is to make sure that the scene is safe for you first and then for the casualty. Before you go charging in there to go save the day, make sure that you're paying attention to your surroundings and the environment. You need to look around carefully to make sure that there are no threats for you and for your casualty. And if there are threats, you need to reconsider your approach. Should you go charging in there? Can you do this safely? Is there a place where you can drag that casualty to make it safer to take care of them? This is very important because if you go charging into a situation and then you get hurt while you're trying to rescue someone else, you have just added another person that needs to be rescued to an already bad situation. So you've just made that situation twice as bad because now there's 2 people that need to be rescued instead of only 1. So you need to stop and think about what your course of action should be. You might feel panicked. You got to act right now or else that person is going to die. And yes, that is true. But if that casualty dies while you're trying to think about what you should do next, then that casualty couldn't be saved. So you need to double check to make sure that the surrounding area, all of the danger is gone or at least reduced to acceptable levels. Should you turn off the electricity to the house? Or should you put out the car fire or drag them out of the car to a safe location? In the military, we would drag them out of the line of fire and behind cover. You need to make sure that your scene is safe for you first, then for the casualty so that you can do the greatest amount of good and make the greatest impact. Step number 3 is to make sure that you're controlling any massive bleeding. If you have a tourniquet, you need to apply that tourniquet as high and tight on the limb as possible, and you're going to crank it down until the bleeding stops. If you don't have a tourniquet or the wound is somewhere else on the trunk and not on an extremity, the best that you can do is just apply direct pressure. You're just going to take the heel of your hand and you're going to put it in the wound and you're just going to push down as hard as you can or until that bleeding stops. So this is very important. You need to try to keep as much blood in their body as possible so that they can remain stable enough to actually get to the hospital. So step number 3, make sure that you're controlling massive bleeding. This is a lot easier if you have medical equipment, especially things like a tourniquet. Tourniquets are hard to reproduce. It takes time to reproduce one, so your casualty might bleed out before you're even finished making the tourniquet. And then improvised tourniquets generally don't work that well. And even if they do work, they might come loose really easily. So having a commercial made tourniquet like your CAT or your SWAT T tourniquets are going to be pretty essential for controlling that massive hemorrhaging from an extremity. If it's on the trunk, then of course you can use your quick clot gauze and try to control it as best as you can with that and a pressure dressing. But for the most part, your tourniquets are going to be a best bet for you, and then direct pressure will help keep all the blood in the body for that patient, get them to the hospital. Step 4 is managing your casualty's airway. We need a clear path for the oxygen to enter into their body so that they can continue to perfuse their tissues. So we need to make sure that their airway is as clear as possible. So one of the ways that you might be able to do this is if they are vomiting or if they have trauma to the face and they're risking choking on that blood, it's just going to pool in the back of their throat, then we need to try to roll them over so that vomit or that blood is able to drain away from their face and isn't complicating their airway even further. Of course, medics and paramedics and doctors all have intubation and all of these other things that they can do to try to manage that casualty's airway. So for you not having that equipment, that might be a little bit difficult, but this is kind of one of those think outside the box types of moments. How can we position this casualty so that their airway remains clear? So try to anticipate that and take care of that as you can. Step number 5 follows along pretty closely to step number 4, and this is to make it as easy as possible for the casualty to breathe. So that we've positioned them in a way that their airway is clear, now we need to make it easier for them to breathe. An example of this would be is if they have penetrating trauma to the chest, one lung is complicated, something that we could do is maybe roll them over onto the side of where the lung is complicated so that there's less weight on this lung to move air in and out of the body and make it more efficient for them to breathe. If the patient is conscious, they're probably going to do this on their own. People like breathing and they're going to try to sit or stand in a way that's going to make it easier for them to breathe. Usually what you'll see is they'll sit or stand. They'll sit on the edge of a bed, or they'll stand and bend over and put their hands on their knees. Just like you might see somebody who has just had a very long, hard, fast run. They're going to be breathing in really heavily and very quickly because they're low on oxygen. They're trying to move large quantities of air into their body, and that position is going to relieve some of the weight on their chest and make it a little bit easier for them to breathe. So if you're wondering if they are having trouble breathing, look at the way that they're positioning. Are they positioning into the tripod position? That's a very good indicator that they're not moving enough oxygen in order to satisfy their O2 requirements. So that's something to pay attention to. Try to position them in a way that's going to make it easier for them to breathe if you can. Now, step 6 is a recheck and reassess. So we're going to recheck all of our interventions that we did. If we put in a tourniquet up on the arm, we're going to check it, make sure that it's not come loose and that the bleeding is still controlled. Anything that we've done for our casualty, we're going to recheck that to make sure that it's still working. Then we're going to recheck our entire casualty. We're going to double check to make sure we haven't missed anything. Maybe you ran up on a casualty and you saw some heavy bleeding from this arm and you started working on that and completely missed. They've got a wound to their right leg. So we want to double check to make sure we haven't missed anything important. If we have, just try to take care of it. Hop on that injury, direct pressure, throw on another tourniquet, whatever you need to do, take care of that casualty. And then we're also going to constantly recheck and make sure that that casualty isn't getting worse. If they are getting worse, it's a good sign that maybe we missed something or one of our interventions wasn't working correctly. So this is why knowing how to do like a quick set of vital signs is kind of important so that you can kind of gauge whether or not they're getting worse or staying the same. We want them to at least stay the same so that they will stay the same all the way to the hospital where they're going to get that real good medical treatment. All right, step 7, the last step. Keep your casualty warm. If they have some traumatic injuries, they have lost a lot of blood, there's a good chance that they are at risk for hypothermia. The blood in your body helps to regulate your body temperature, and if you don't have enough, then you're probably going to have some issues with that. And if hypothermia sets in, then it's going to further reduce their ability to recover, and maybe to the point where they won't recover. So we need to make sure that we're keeping them as warm as possible. Even if it's a bright, sunny day outside, maybe you're in the wastelands of Afghanistan, this is still a risk. They're not able to regulate their own body temperature, so we need to make sure that we're paying attention to that ourselves. So most of the time, or hopefully, this won't become an issue because you've called 911 and paramedics are on the way. See how important that step is? But if you are out in the backcountry of the Rocky Mountains and it doesn't look like help's going to be getting to you for some time, start thinking about keeping your casualty warm. Do whatever it takes. Start a fire, pile on coats and blankets, put them in a sleeping bag. Whatever the case is, you need to try to keep that casualty as warm as you can until help can get there to take over for you. So make sure that you're keeping that casualty warm. All right, guys, that's it. 7 steps for saving somebody's life. I appreciate you hanging out with me and listening to me talk about some of these things. I think that if you know how to do each one of these 7 steps, you can perform each one of these well enough, there is a good chance that you can take care of somebody who needs your help. Not every casualty is savable. A good medic knows that there's just some people who take wounds and there's no way to save them, and there's nothing you could have done to save them. But if you follow these steps, there's a good chance that if that casualty is savable and their death is preventable, then you will prevent their death. So pay attention to all of these things. If you don't know how to do some of the things that I talked about today, hang in there. Some of my later videos are going to go into what those things are and how to do those things. So if you don't know how to get there, we will get you there eventually. And I appreciate you guys sticking it out with me. If there's any questions that you have, anything that needs clarification, or maybe you just need to comment on one of these steps, maybe you've used one of these steps or all of these steps to save somebody before, let us know. Tell us down in the comments, and I will do what I can to answer any questions and respond to any comments as possible. But again, thanks for sticking it out with me, guys. I appreciate it. Subscribe for more content like this, and I appreciate it. Later, guys.